Hey, Brendan. I am getting our comment pinned, and we will get going. Still haven't gotten really good at this. Pinning the comments. It works, sometimes it doesn't. But hey, gives me time to let people get in the room with us. And yep, it's my last live, which is bittersweet. Come on, man, I can't get this posted. What's up? How are you? All right. So, we're almost there. Bear with me. Jesus Christ. And my fingers. Hey, no filter DC. I have no filter either. It's part of my problem. All right, so today is bittersweet. And it is bittersweet because today is my last Instagram live. I've been doing this with Whitman-Walker for almost 2 years. Oh my God, in October, I think it would be 2 years. So we're like at 1 year and 10 months now. But it's been a pleasure to be here. It's been a pleasure to be able to provide you all with information. But most importantly, during a time where we've had to spend so much time and space apart, it's been amazing to come on here and to give you all updates about what's happening with COVID-19. You know, how we can protect ourselves from STI and other sexually transmitted infections. And it's just been good to get on here and just learn about keeping ourselves healthy and whole during this entire pandemic. So if you do not know me, I'm David Wilson. Again, today's my last day, but I am, for at least this live, a Whitman-Walker influencer. I will not be after this, but it's been amazing. Today, I want to give my final update about COVID-19. We have other Instagram influencers who will be on here and to continue my legacy, I should say, on getting on here and providing you all information about, all the stuff that we do at Whitman-Walker Health. But today, I want to focus specifically on the pandemic, but in terms of boosters, immunizations, as far as breakthrough cases and things like that. That's going to be the topic of our conversation today. If you have any questions, feel free to drop them in the comments. I will be sure to answer any of those that you come up with. And since this is my last live, please follow me on Instagram at Sir Dave, which is Sir_Dave_. And you can stay in touch with me there. So, updates. As of yesterday, there have been over 120K new COVID cases reported. And that brings us to around a 40 million total of cases since the start of the pandemic. Hospitalizations. About 3 days ago, the U.S. actually reached a daily average of 100,000 COVID hospitalizations. That is pretty much the peak that we've had since wintertime. The daily average for hospitalization of COVID-19 patients is now over 100,000. Like, can you imagine that? It seems like we're taking a step back, from where we were a few months ago. When people first started getting vaccines, we saw that rate going down. When people first started getting vaccines, we saw the amount of cases going down. But now we're back in the heat of a new event. And that new event is what is going on with the Delta variant. And so we've been getting so much information pushed out to us, whether that be from the CDC or news outlets or whatnot. But you need to stay up to date with everything that's happening right now. Now, as far as deaths have been, as of yesterday, 769 new deaths were reported. And that brings us to a total of 630,000 deaths since the start of the pandemic. That's a huge number. I know that is probably the worst thing we could probably talk about on today's live. Which is why it's still important for everybody to get vaccinated. Currently, vaccinations in the U.S. have reached, and this is for fully vaccinated people, 174.1 million. That's actually really, really good. That's really good that many people are fully vaccinated. However, there are still tons of other folks who still need to get vaccinated. According to the CDC, 996,000 people received an additional dose of the vaccine between August 13th and today. And so that is good. We're seeing people getting additional doses, whether that be a second dose or whether that be a third dose. We'll talk about that later in the live. But people are getting additional vaccines. Now, I did mention that third dose. What could that mean? So there have been lots of conversations about the effectiveness of our vaccines after a certain amount of time. For a while, we didn't have enough information to actually give advice on whether or not boosters would be required. Now, if you've paid attention to the news, you've probably heard that there have been some recommendations that we might need boosters depending on the type of vaccine that you got. So millions of Americans have actually held back from getting their first COVID-19 shot. And if you are one of those Americans, please go out and start that vaccination process. But there are some who will soon be up to get their third vaccination. I am one of those people. Because I got my vaccination earlier, it is likely that I will have to get a booster sooner. So U.S. health authorities plan booster shots for fully vaccinated adults starting the week of September 20th. So that's about 3 weeks away, where we might see the U.S. opening up or the possibility for a third booster shot to those people who have been vaccinated. Now, you're probably asking, well, who can get theirs first? Again, as I mentioned earlier, this is all dependent on the review of the FDA and a panel of CDC advisors. However, the plan is that all adults who received either the Pfizer or Moderna vaccine will be eligible for a booster dose after about 8 months after they received their first dose. So, for example, I got my first dose in February, which means I should be looking around the October time frame to get my booster dose. All right. And so I'm sure you're probably asking, well, what about the J&J? That covers Pfizer and Moderna. You have to get the booster for Pfizer and Moderna. What about J&J? It is anticipated that the people who got the J&J shot will need to get boosters as well. But that is still pending on more data being produced. We don't really have the answer to that today. Now, I know you're probably like, oh my God, here we go. We've gone through the first 2 rounds of shots, and now you all are telling us that we have to get a third one. So why that decision, right? The evidence that has persuaded authorities that this is the time to do this was actually pointed out by the CDC director, because there are several new lines of evidence that actually show protection begins to decrease over time among vaccinated people. For example, new data from New York showed that the vaccine effectiveness against new infections declined to from 92% in May down to 80%. So that's a reduction of over 12% and just between May and July in a fully vaccinated person. So this is around the time that the Delta variant was surging and more people we're having breakthrough infections. So as you can see, it's important that we get that booster. If we were at 92% rate effectiveness in May and then at 80% effectiveness in July, just imagine where it will be in October. Where will we be? 76, 60? We don't really know, but it is enough data to let us know that we will require a booster. So also we've been hearing information about, immunocompromised individuals, about their vaccination status. What should they do? Now, for immunocompromised folk, people with moderately, and that can include people with moderately to severely compromised immune systems, are especially vulnerable to COVID-19. And those individuals may not build up the same level of immunity to a 2-dose vaccine regimen compared to people who are not immunocompromised. So the additional dose is actually intended to improve those people's immune response to that 2-dose vaccine series. So although the CDC does not recommend additional doses or booster shots for any other population outside those who got it really earlier and may require a booster, Health and Human Services has announced that a plan to begin offering the COVID-19 booster shots will happen in September 2020. All right, now the CDC recommends that people with moderately to severe compromised immune systems receive an additional dose of the mRNA COVID-19 vaccine at least 20 days after a second dose of the Pfizer BioNTech COVID-19 vaccine or the Moderna vaccine. So if you're immunocompromised, those are the advice. That is the advice that we've received as far as receiving the third dose. Now, what does it mean to be immunocompromised, or who could potentially be in that particular population? Someone that could be someone who has or is receiving active cancer treatments for tumors or cancers of the blood. If you're a person that had an organ transplant and are taking medicine to suppress your immune system, maybe you received a stem cell transplant within the last 2 years, or you're taking medicine to suppress the immune system, or maybe you are just, were born with moderate or severe immunodeficiency. That could be DeJoy steroid or Wiskott-Aldrich syndrome. There are several, immunocompromised deficiencies that could be identified. Also, if you have an advanced or untreated HIV infection, then you might want to consider the third dose. Active treatment with high dose or steroids or other drugs that may suppress your immune response will also might be a reason to consider getting that third shot. Now, I will say that people should talk to their healthcare providers about any medical conditions that they have, because or any other drugs that you might take that might suppress your immune response, because this isn't like a one size fit all. These conversations need to happen with your medical provider, and that is probably the best approach to take to figure out if it is needed, if your third shot is needed because you are considered immunocompromised. Now, all of this information about getting an additional dose, we have talked in the past about vaccine cards and what that means. So let's talk about what that means now. So if you receive the 2-dose vaccine or the 1-dose vaccine and you have your vaccine card, you will use that same vaccine card to record your third booster dose. So at your first vaccination appointment, you should have gotten that card. If you didn't, you should probably reach out to the place where you got vaccinated and ask them about getting a card. Now, your card tells you what dates you got the COVID-19 vaccine for each shot, and that should give you an idea of when you should be receiving your next shot. Again, if you got the Moderna or the Pfizer, then 8 months after your initial shot, you should be seeking a vaccine, and that should be available after September 20th. Now, bring your vaccination card to your third dose vaccination appointment so that it can be completed and filled out properly, especially since there are so many institutions at this point that are requesting to see your vaccine card. I am currently in LA, and right now you cannot go to a bar or a restaurant or most places without showing either a negative COVID test within the last 48 hours or your vaccine card. So it's important that you try to keep track of that vaccine card, but it's also important that you record the vaccines that you're receiving on that card. Now, mask. Remember that back in July, on July 31st, all people over the age of 2 must wear a mask indoors regardless of vaccination status. That has not changed. Continue to wear your mask, especially indoors. Continue to follow CDC guidelines. Now, if you're not vaccinated, where can you get a vaccine? You can actually figure out where to get a vaccine closest to you by visiting vaccines.gov. You can literally put in your zip code and it'll spit out a directory of vaccination sites where you can go and get a vaccine. Now, testing. If you're living in DC, DC still offers free COVID-19 testing. I've actually seen that they are starting to give out at-home self-tests for some at some locations. So, if you're interested in any of that information, you could visit coronavirus.dc.gov/testing to find a location. And yeah, you can get your tests. You can also visit that site to see testing, vaccination sites, and all of that in DC. Now back to the CDC guidance. Again, if you're fully vaccinated, you can participate in some activities that you used to before the pandemic. Now with the Delta variant surging, you should be trying to protect yourself and protect everybody from possibly spreading that to others. So continue to wear your mask indoors, especially in public. You know, if you are in an area or of substantial or a high transmission or a high capacity, high volume of people, then you should consider wearing your mask as well. Also, if you are immune compromised, wear a mask. You don't really know who is vaccinated or unvaccinated around you, so there's no real way to identify who those folks are. So just consider protecting yourself and those around you. Also, I do want to remind you all that Whitman-Walker is open for HIV and STI testing by appointment only. That's at our Liz location and our Max Robinson Center location, which is located in Southeast DC. You can make an appointment by calling 202-797-4439. Also, we are still doing COVID-19 testing. You can do that by emailing us at appointments@whitmanwalker.org. And are there any more questions? I don't see any questions. Well, if you haven't been vaccinated, continue to follow CDC guidelines for mask wearing, quarantine, social distancing, and all of that. And it is very, very important that you get your vaccine. Continue to discuss your COVID precautionary measures and take those things seriously, especially when you are around people and you do not know their vaccination status. Continue to be mindful of your mask, wearing your mask, keeping your distance, especially when you don't know whether or not a person has been vaccinated, like I said. That's all the information I have for you today. I will say that today is my last live. It's been a pleasure getting on here with you all, providing information about COVID-19, HIV, STI, practices, social determinants of health, and so on and so on and so on. But most importantly, continue to follow us here on Whitman-Walker Instagram page. You can also follow us on Facebook, Twitter. You can also follow our other pages, Real Talk DC _. Also, you can follow us at No Filter DC and our cool space that we have on 14th Street, The Corner DC. This will be my last time on here with you all today. But I have, again, enjoyed myself. It's been an amazing 2 years, and I will miss seeing and being on here with you all. Follow me on Instagram, Sir_Dave_, and you all have a great day.